Ozempic, Mounjaro, Wegovy, Zepbound. These are called GLP-1 drugs, and they've been taking the world by storm recently. But the truth is, they've actually been around longer than you think. Today, I want to talk about these drugs in the context of weight loss use in a way that you probably haven't heard before, especially as from the perspective of a physician here in the United States. It's actually interesting to see these drugs suddenly become so popular in the last 5 years or so. They actually have been around in medical practice for about 20 years, mainly for diabetes treatment. As an internal med doc, these drugs have been pretty much commonplace in practice since the beginning of my career. And I think you'd be interested in hearing an experienced perspective of working with these drugs. I actually love talking about them with patients a lot, and patients often ask about them a lot too. It's often the first injectable drug they use for their type 2 diabetes. In this video, I want to talk about a lot of different things that really aren't considered. I want to discuss things the marketing companies of these drugs won't mention, and also talk about things that people don't notice without seeing people on these drugs for decades. And these are actually both good and bad things that we'll be talking about. So, first, to start off, what are these drugs? Just to give a quick summary perspective and make sure everyone's on the same page. So, these GLP-1 agonist drugs like Ozempic or Mounjaro or Wegovy, they are hormonal drugs. And like many hormones, they have a broad range of complex effects throughout the entire body. But I think if you can simplify it, it can actually make it pretty easy to understand what they do. So, like their name, they mimic GLP-1. What it stands for is glucagon-like peptide. Some, like tirzepatide, Mounjaro, have other effects as well in the body, but that's a different conversation, and this is the main effect. So, natural GLP-1 hormone comes from the small intestines, and you can think of it in your body as basically the signal link that connects your digestive system to your other organs, such as your heart, skin, brain, pancreas, lungs, and even immune system. These GLP-1 drugs have actions throughout the body. So, by mimicking this signal link, it's basically telling the rest of your body that you have a ton of food in you, whether you really do or not. And that's really the big picture mechanism of how it works. So there is a massive cascade of systemic effects with all these organs, but the two main things that it does is it makes the pancreas more sensitive to your glucose levels, and it slows your stomach motility. So these are diabetic drugs that have been around for a while. The question you probably have is, why now? Why are they getting popular now? And the likely reason for that is because the drug suddenly had a push in the last 5 years due to getting the labeled indication for weight loss management. And with that, a huge marketing push. So, yes, all drugs are heavily commercialized, but these GLP-1 drugs particularly so. In the clinic, it's fascinating to see the perceived difference in the different brandings of this drugs, even when it is the same drug underneath. Like these names, Ozempic, Mounjaro, so many people are familiar with them now. But it's actually more than just a marketing push. These drugs are very special. I think a big part of this commercial success is that the drugs do in fact work very well, both for diabetes management and weight loss. For diabetes management, this drug class is debatably one of the strongest non-insulin medications for type 2 diabetes control. And they are also very effective drugs for weight loss. For example, for drugs like tirzepatide, Mounjaro, there is some evidence that shows that they are almost as potent as bariatric surgery. And that actually is probably the best parallel it has. These GLP-1 drugs, especially the more potent weight loss ones, work almost like non-operative bariatric surgery, focused on impacting stomach function and food release. But just like bariatric surgery, these GLP-1 drugs, they're not necessarily great when used alone. You still need dietary modification. You can, for lack of a better term, like eat through the effectiveness of these GLP-1 drugs, just like a bariatric surgery. Anecdotally, for example, I see it in clinic pretty often. People who are on these drugs for many years, but if they don't watch what they eat, they can be on like a max dose Ozempic and still trickle slowly back up in terms of their body weight and their diabetes control. So, even though these drugs are very effective for weight loss, they do still need diet and exercise in order for the best results, especially if you want results that last. On the topic of results, it's also important to understand that the labeled indication is for weight loss. These are drugs with weight loss indications, not fat loss indications. And that's a very specific labeled indication and a very specific verbiage. Like I said earlier, the best parallel is non-operative bariatric surgery is what this is kind of like a light version of bariatric surgery. Would you ever consider giving an athlete bariatric surgery or some professional that's trying to lose weight? I can't speak for every profession, but they probably don't want that. So just because these are good drugs doesn't necessarily mean that they're a perfect fit for everyone. The evidence isn't conclusive for what specific balance of fat loss versus weight loss of other sources is, and companies with their sponsored studies will obviously go back and forth with which one is the best drug, which one has the best fat burning, or which one has a non-inferior result to this or that. And it's also important to note that even if you're losing fat without drugs, you're usually still at least losing some muscle or some other tissue with it as well. So, fat loss versus weight loss. There are actually a ton of drugs in the world that do both of these things, but I think one of the things that make these GLP-1 agonist drugs special is that they have, in the grand scheme of things, very reasonable safety profiles, especially when monitored. When monitored, people can stay on them almost indefinitely as long as they're getting benefit. There's even some evidence of some specific GLP-1 drugs improving heart disease, kidney disease, and vascular disease outcomes in the long term. But the results and the evidence of that gets sporadic and very nitpicky, and it's really outside the scope of what we're talking about here today. That said, these are still drugs that you really should not be trying to get a hold of yourself or buying from a foreign country without a prescription. And this is for many reasons. The first is that fakes of these drugs are actually becoming a real problem, especially uh, in the last several months in the United States. There's been a shortage of a couple of these drugs, whether it's from the manufacturer production side or from the consumer usage side. It's hard to say, but in the process, I have seen patients bring to clinic fakes of these. And as an injectable drug, this can make it very dangerous. Another thing is these drugs always come with injector pens to be used, and the manufacturer tries their best to make them simple, but it can still be complicated at first to figure out. So it can be important to have someone guide you through how to safely use it the first time. On the subject of getting a hold of these drugs, so the prices of these drugs, at least in the United States, they're actually rising. Without insurance, they're like $1,000 to $2,000 a month, depending on where you are and which drug you choose. Depending on which insurer you have, they might choose one over the other for you. So this kind of becomes a conundrum because these different GLP-1 drugs have varying amounts of weight loss effectiveness. But on the bright side, because these drugs are so common now, many clinics have a streamlined prior authorization process for them. So I know I mentioned earlier these drugs have good safety profiles, but there are still some medical problems that you should be aware of. People with pancreas problems need to be very careful with this drug. It can even cause pancreatitis. People who already have gastroparesis makes this drug not a good fit for them. And also patients with a family history of thyroid cancers, specifically medullary thyroid cancers and some of those inheritable patterns of thyroid cancer. It makes it a very bad fit. The reasoning behind that, the evidence behind that was actually in some non-human studies, but because of the slow growth of these cancers and how we build these studies, it's just a precaution that people have to be aware of. So, in summary, the GLP-1 family of drugs are potent diabetic and weight loss drugs. Think of them as like a hormone drug that tells your body you're already full of food. It has potent effects throughout the body, including effects on the brain, the immune system, and many other organs, but the main effects it has are slowed stomach emptying and increased pancreatic sensitivity. In functional terms, it has weight loss and physiological similarities, almost like a light, non operative version of bariatric surgery. Even if you're on these drugs, though, you still have to try and improve your diet and exercise if you want long lasting benefit. And finally, these are reasonably safe drugs, but you still shouldn't try to acquire them or manage them on your own without a physician, both for safety reasons and for cost reasons. So, thanks for listening today. New videos every Saturday.